There is so much completely false information about sleep apnea claims, so I'm going to clear this up. At the end, I'm going to have a board certified psychiatrist talk about how he will go about connecting sleep apnea as a disability.
Whiskey 9 Yankee 7 November Golf, over.
Let's look at direct service connection and secondary service connection. And most veterans are going to fall in the secondary service connection because let's be honest, who gets a sleep study while they're active, let alone go to medical at all? The easiest direct service connection is going to be to have a sleep study and a formal diagnosis while you're active duty. Now, is it possible to have a direct service connection with complaints of snoring, complaints of always feeling tired, and having statements? That answer is yes, but I wouldn't count your chickens. And this leads us to secondary service connection. And the most popular service-connected disability for sleep apnea is going to be PTSD. And listen to me very, very closely here. I do not care who tells you PTSD causes sleep apnea. It's absolutely false, and that's just that. There is medical literature that supports a correlation of PTSD and sleep apnea, but there is nothing that supports a causative link between PTSD and many other service-connected disabilities and sleep apnea. Even for other conditions that have something to do with the respiratory system, like sinusitis and rhinitis, are still pretty difficult to connect to sleep apnea. Now, asthma has a very good shot, and we know that sleep apnea and asthma are commonly rated together. So what does all this doom and gloom actually mean? It means you can support a sleep apnea secondary claim, and I would recommend you do so without an independent medical opinion, and if you're denied, then you might want to consider getting a private Nexus. In my experience, and I've seen thousands of claims, seriously, sleep apnea is a coin flip. Sometimes it's connected, sometimes it's not. A C&P examiner can absolutely connect sleep apnea secondary to PTSD, but will they? That's a whole different story. I'm going to show you these correlating factors. Then we're going to have Dr. Sharma, who went to med school and isn't some dude in his basement, actually explain how he connects sleep apnea secondary. There are many correlating factors, but the most common I see are weight gain. If you are overweight and your IMO does not factor in weight gain, it is highly possible the VA will deny your sleep apnea claim. You have to look at all the evidence, and that's what the VA is going to do. Breathing in heavy particulates, turns out being near a burn pit in highly polluted areas is bad for your breathing. Medications like gabapentin, this is known to lead to sleep apnea. And of course, you need a service-connected disability that correlates to sleep apnea. And causation and correlation and all that stuff.
Absolutely, yeah. And yeah, so with sleep apnea, this is one of the toughest ones. And I always tell folks who come to me about it, it is an uphill battle most of the time, right? But basically, there's a few ways that you can go about it. It's all secondary, just like Clay said. So for instance, I mentioned, the alcohol use disorder, things like that. Keep in mind that PTSD does not directly cause sleep apnea. There are a lot of folks out there who will tell you that they will write you a letter that says that, but there is no mechanism of action there between PTSD and obstructive sleep apnea. There's two things you really need, right, for a causation. So you need to have the study showing that there is a correlation, right? And then you have a mechanism of action, right, between these two conditions. And then you can draw and make it a causal relationship, basically. But PTSD and other mental health issues certainly cause other things that can indirectly then connect to obstructive sleep apnea. For instance, if somebody has major depression or PTSD and they gained a lot of weight, emotional eating, things like that, that can be weight gain that could lead to obstructive sleep apnea, right? We have to be very careful with the documentation with that. We have to be very meticulous and document the weight. That's what I usually review when I do the record review. That's one example. Also, alcohol use disorder. Alcohol use disorder is frequently coming up when people have PTSD or other mental health conditions because it's in a self-medication pattern, right? So we can connect alcohol use disorder, right? And then we can connect, then we can connect obstructive sleep apnea from that. Also, medications. So, certain medications like benzodiazepines that are anti-anxiety medications, they can worsen sleep apnea. Certain hypnotics like Ambien, Restoril, things like that. Mental health medications can cause weight gain, right? Which then cause the sleep apnea. Those are just some examples. There's a lot of examples out there, and it sort of depends on each person.